Good evening, Steve and Sharon. The Virginia Department of Health now recommends taking no action, and that would mean existing medical or religious exemptions would stay in place. This review comes after a bill was pulled earlier this year that would have either eliminated or severely restricted those opt-outs.
Virginia's exemption rates are low. There's not been an outbreak in Virginia, and there's no compelling reason to change the law.
That's what analysts say was found in many of the public comments about Virginia's vaccine requirements. Wednesday in Richmond, the Joint Commission on Health Care learned 674 out of 679 submissions favored keeping the rules as they stand.
All done.
Current Virginia law allows parents to opt out of vaccines for their kids if there's religious or medical concerns. Supporters of the status quo believe doctors cannot predict who will have a reaction, and parents should have the power to decide what's best for their children.
I had to use a religious exemption after my son reacted to a vaccine, but I did that with a lot of prayer. I did that in consultation with my pastor and a lot of soul searching.
Kathy Williams and Vicki Pebsworth of the National Vaccine Information Center attended Wednesday's briefing. They say they were pleased with the outpouring of comments against changing the law.
Under some of the proposals that had been floated, he and most of the rest of the other children that I know who have medical exemptions would have lost their medical exemptions. And I don't know what we would have done.
But critics have argued that vaccines are by and large very safe. Other comments said,
not vaccinating children puts everybody at risk, and the use of religious exemptions in Virginia has nothing to do with religion.
The American Academy of Pediatrics proposes some changes and would support either tightening up or getting rid of religious exemptions. The board plans to vote on recommendations for the General Assembly in November, and until then, you can still be submitting your public comments. Alana Austin, NBC 29 News at 5:30.